We're going to begin talking about EMS systems, and this section will probably be broken into two different videos. So we'll go ahead and get started. So many EMS textbooks start with modern history, or EMS history in the Napoleonic era. And so we're going to skip all of that because EMS has matured enough at this point to give us a lot of history in the 20th and 21st centuries. So that's where we're going to start at with this. So modern EMS history begins in 1966 with the publication of what we refer to as the White Paper. The title of that was Accidental Death and Disability, the Neglected Disease of Modern Society. And this was really the beginning of defining the need for an EMS profession and the need for training of specific individuals to be able to do this, as well as training for hospitals. Hospitals were very different in the 1960s than they are today. So there was information in the white paper on how to improve hospitals, how to improve what became to be known as pre-hospital EMS, and also in data collection and all sorts of things. So the problem was in 1965, there were 52 million accidental injuries, deaths, and disabilities. The cost of this was $18 billion in 1965 dollars. To put that in a little bit of perspective, in 2018, that $18 billion would have been worth $141 billion. So that's a lot of money. Of those 52 million injuries, deaths, and disabilities, there were 49,000 deaths from motor vehicle accidents. So the white paper discussed several aspects of the problem. One was accident prevention. The next was emergency first aid and medical care. And remember, EMS had not been created yet. There was no title or term called emergency medical services at the time. So they were calling it emergency first aid and medical care. The white paper discussed development of trauma registries, hospital trauma committees. Remember this, the white paper goes back to injuries and trauma. There was no thought at the time, at least as far as this white paper is concerned, about medical conditions. It was all focused on trauma. There was discussion of convalescence, disability, and rehabilitation. Again, very different in 1966, 1965, very different from what we know today with rehab facilities and the such. Those were not there at the time. Discussed medical legal problems, discussed autopsy of victims. One of the things that was being discovered in this era during the Vietnam War was that the military was doing autopsy of the soldiers who were killed in action, and they were finding discovering how people were actually being killed, what was happening inside the body when this was occurring. And so we know that from physics that there are a lot of forces that are applied to motor vehicle accidents, a lot of forces to the vehicle, a lot of forces to the occupants of the vehicle. So the white paper proposed doing autopsy of the victims to see exactly how they were really dying. They discussed care of casualties of natural disasters and also discussed trauma research. So in 1966, Congress created the National Highway Safety Act of 1966. It's actually created the U.S. Department of Transportation. And again, because the problem that they were looking at were motor vehicle accidents. It was put under the Department of Transportation. Therefore, everything that was new that was being created was also put under the Department of Transportation as well, such as this new emergency first aid and medical care that would become known as emergency medical services. So that's how we ended up under the Department of Transportation. In 1968, President Johnson's Committee on Highway Traffic Safety met. They drafted BLS and ALS training standards. This was the very beginning of the thought of what these soon-to-be EMS personnel were going to be doing. Principles of a 911 system. 911 was not in effect at the time, and so there was, anytime anybody needed police or fire, they would call a 7-digit number, or sometimes there were abbreviated local numbers in large cities. But the 911 system had not been developed yet, so they proposed principles of a 911 system. They recommended a national certification agency, which became what we later became what we know as the National Registry of EMTs. In 1969, Dr. Eugene Nagel, who is considered the father of paramedicine, was working with the Miami Fire Department in Miami, Florida, and creating, again, what would become known as paramedics. The equipment was very rudimentary. They would take equipment from the hospital, which electronics of the day were extremely large, very heavy. They would take this equipment and try to make it fit a pre-hospital environment, sometimes re-engineering some of the equipment to make it work better outside the hospital. At the same time, the Miami Fire Department wasn't the only area looking into these things. At the same time, you had places like New York City who were doing similar things. Indianapolis, Indiana was doing very pioneering things around this time as well. Los Angeles, California, down in Texas, you had Dallas and Houston who were doing great things as well as many other places. In 1969, standards for ambulance design and equipment were published. Again, remember there weren't any ambulances, and there was no real equipment list for an ambulance. So all of this had to be created. So this was the first standards were published in 1969. In 1970, the National Registry of EMTs was formed, and in 1971, they administered their first BLS test. The National Highway Traffic Safety Administration is created under the Department of Transportation around this time. NHTSA, as we call it, is given the responsibility to develop EMS. So under the Department of Transportation, under every federal department, there are administrations. And so the National Highway Traffic Safety Administration was under the Department of Transportation and given that responsibility to develop what would be called emergency medical services. In 1971, the first EMT textbook was published. It was called Emergency Care and Transportation of the Sick and Injured by the American Academy of Orthopedic Surgeons. And if that sounds familiar, that's the predecessor of the textbook that this particular course is using. I believe this is the 11th edition of that book. But the American Academy of Orthopedic Surgeons published that first textbook. And remember, going back to why EMS was being created was to treat victims of motor vehicle accidents. So you're talking about trauma. So the American Academy of Orthopedic Surgeons decided to take this on to teach non-physicians how to treat different types of trauma. In 1971, a television show called Emergency aired for the first time. On January 15th, 1972, it was began mid-year, mid-season, and it aired on Saturday nights. So in class, I'm going to ask you who can name at least one of the characters in this picture. And we know that television shows are dramatized and television shows are not real life. However, this particular show had a huge impact on the development of EMS, not only spurring a lot of young people at the time to say, you know, hey, I want to do what these guys are doing, but it also allowed the public to see what was being done in Los Angeles. And lots of people, you know, around the country began saying, we want this as well. So as we continue on looking at modern EMS history, in 1973, the Emergency Medical Services System Act of 1973 was created. Authority was given to the U.S. Department of Health, Education, and Welfare, now called the Department of Health and Human Services. And so the Department of Health and Human Services administered this act, and grant money was given out for studying EMS system design, startup costs for state EMS systems, and research. The act set initial EMS standards. For example, an adequate number of personnel with proper training, continuing education of personnel, integration of a central communication system, or now we know it as 911, an adequate number of ground, air, and water vehicles, and adequate facilities to transport the victims to. It also established a central federal EMS agency, provided grants to schools for training. They also provided money to study legal barriers. Again, this was a new profession. No one had, there weren't laws created at the time to allow these new EMS personnel to actually work. And there were legal barriers, the way the laws were written. Nurses, physicians had specific scopes of practice, but there were no scopes of practice for these new workers.